Welcome learners. In this session, we will be discussing collection of pediatric history. As we know that history taking is an art. What all things do we need to know before taking history of a child? Communication with the child and parents. Communication is the key skill to develop rapport with the child and the parents. History taking and counseling for promoting child health, both these tasks require effective communication. The essential skills for effective communication are talking and presenting clearly. As a nurse, while you are taking history from the parents, talk clearly and present facts clearly in a language which the parents can understand. Listening and giving attention is the second skill. It is very important to listen carefully to what the parents are saying and giving attention to them. If a nurse is listening properly and giving attention to whatever is being told by the parents, she will be able to collect the history well as able to capture the problem about which the parents are discussing. The third skill is discussing and clarifying. If at all you feel that whatever parents are telling, you are not able to understand that or there is doubt in that, you should start discussing the points and seek more clarification so that after clarifying the doubts, proper facts are recorded. So these are the essential skills required for effective communication. Eliciting the case history. How to get to know what is needed in order to make a good history. Use open-ended questions with few specific close-ended questions. For example, if you want to know about the problems that the child is suffering from, ask the mother, how is the child feeling? What all problems can you see in the child? What are your observations regarding your child? Please tell me more about the condition. Please clarify this condition. Please clarify what do you want to say. Is it this that I have understood? Is it correct that I have understood? Like this, seek answer from the parents. Asking lot of open-ended questions gives freedom to the parents to speak. Listen actively to the parents. Actively means you should appear to be interested in listening to the parents. If you listen actively, the parents will take interest, let you know more about the child. Give encouraging response like nodding the head, saying yes, okay, I am able to understand. Will you tell me more? Okay, you are telling correctly. Very nice, very good, good observation. I am happy to know this. Very nicely you are telling. Responses like this will encourage the parents to speak about the condition of the child. Be empathetic. For example, if a parent is telling something which is very sad related to the child, you should appear to be interested in listening to them. Similarly, you should appear to be empathetic or sad to know about the sad news. You should not appear to be happy while listening to something which is sad. So, this will make the parents feel involved as well as you can show your attentiveness as well as your involvement to the parents. List the problems whatever have been told by the parents in order to avoid getting to know or recording any problem which the parents had told. For example, tell the parents like you told about the problem of constipation, you told about fever, you also told about the child's breathing difficulty as well as itching. Do you want to know or do you want to tell about anything else apart from these 4 problems? So, this is how you should list the problems and confirm from the parents that are these the only problems that they have told, or are there any other problems also which you might have missed. Use words that the patient or the parents will be able to understand. That means avoid speaking medical terms, avoid speaking in jargons, avoid using a language which is difficult for the parents to understand, because if you speak in medical terms, the parents will not be able to understand. If you speak in a language which the parents are not understanding, then they will not be able to reciprocate well and you will not be able to collect the history. The process of history taking. So, the first part of history taking is gathering information about the demographics of the child. This part is included in general information. So, general information about the child includes talking or asking about the name of the child, father's name, gender of the child, his or her age, date of birth, address, contact number and the diagnosis. The second aspect of history taking is history of present illness. History of present illness includes current problems with which the child is admitted. Record the problems verbatim, that means in the language that the parents have told. Suppose if the mother says, मेरे बच्चे को बुखार है, you have to record mother's complaint of altered body temperature. Do not give it a medical term like mother complained of fever. You need to record verbatim in a language or in words that the mother or the father has used. This is done in order to avoid any sort of conclusion in identifying the problem and making the diagnosis later on. Record the problems in chronological order along with duration. For example, child is suffering from altered body temperature since 2 days, cough since 1 day, breathing difficulty since 1 hour. This is how we should go about recording the problems of the baby. Provide status of complaints till date. For example, if you have mentioned about presence of fever, cough and breathing difficulty, you also need to mention, do they still persist or any of the problems has been resolved as of date. So, this needs to be mentioned in the history. There may be symptoms which the child may be suffering from earlier, but now they have been resolved. So, this has to be clearly mentioned in the history. For example, the current episode with which the child is suffering from may have started in form of minor or minute pain somewhere in the body. After the pain, the child developed fever. After fever, the child stopped eating food. So, when you are recording history of present illness, you need to mention that pain has been resolved, appetite has returned, but the child is still suffering from fever. Assess each symptom with respect to onset, nature of onset, duration, frequency, consistency, aggravating and relieving factors and response to treatment. For example, fever may be acute in onset, pain in abdomen may be insidious in onset, loss of appetite may be insidious in onset, or gradually the child has developed a particular symptom. So, the nature of onset, whether it is acute or it is insidious, needs to be mentioned. The next aspect of history taking is history of past illness. Collect the past medical and surgical history. For example, if the child has had any fever episode, any episode of seizures, jaundice, typhoid, or any surgery in the past, because these conditions may be significantly associated with the present episode. The fourth aspect of history taking will be focusing on personal history. It should include information about all the important events in child's life till date. It will include the developmental history, immunization history, nutrition and dietary intake, as well as history of school performance. Talking about the developmental history. Developmental history includes the milestones that the child has attained, whether the milestones have been attained as per age or is there any delay in the achievement of developmental milestones. History of immunization will include whether the child has been immunized till date or not, whether the child has taken all the vaccines recommended for age or not. If yes, well and good. If not, then what was the reason of delay or no immunization? Nutrition and dietary intake. This will include information about whether the baby is on breastfeeding or is on weaning diet and present day intake. So, information regarding the diet of the child needs to be obtained. History of school performance will also be included in personal history, because there may be certain children who show problem in school performance, and this problem may be associated or may be the result of the condition that the child is suffering from. So, it is very important to get information about school performance of the child. For example, a child who is suffering from autism or a condition like dyslexia, the parents will give history that the child is obtaining poor grades in school. Antenatal, natal and postnatal history is the fifth aspect of history taking. In antenatal history, collect information on maternal nutrition, weight gain, illness and any drug intake during pregnancy, number of antenatal checkups done and iron and folic acid supplementation obtained, along with TT status or the status of TT vaccination, that is tetanus toxoid vaccination, whether received or not, one dose received or both doses received, and history of radiation exposure, previous abortion and adequacy of fetal movements. All this information needs to be sought from the mother. The birth history will include information on place and mode of delivery, whether the baby was born by LSCS or lower segment cesarean section or whether the child was born normally. The period of gestation, that means whether the baby is a term baby or was born preterm or premature. The person who conducted the delivery, whether it was conducted by a trained person or was conducted by a DAI or an untrained person. The place of delivery, that means whether the delivery was conducted at home or in the hospital setting or in some clinic. The color of amniotic fluid, whether it was cleared or it was like green color, it was stained. The duration of labor, how long was the mother in labor, prolonged labor or was it normal labor? The Apgar score of the baby, whether it was normal or it was less than normal. Any resuscitation measures that were required. Initiation of breastfeeding. Rooming in, whether it was done or not. The birth weight of the baby. Then whether the delivery was spontaneous or it was induced. So, this all information has to be collected in the birth history of the child. Coming to the postnatal history, it should include details of cry after birth, whether the baby cried immediately or the cry was delayed, extent of resuscitation required That means whether the child was able to start breathing on his own or the baby required administration of positive pressure ventilation along with chest compression. So this history is required. It is very important. The time taken after birth to pass urine and meconium. When was breastfeeding started? Whether it was started within an hour of birth or it was delayed. The reason of delay. Any pre-lacteal feeds administered like ghutti or honey or water given to the child. Any problem in the newborn period like breathing difficulty, poor feeding, development of jaundice, cyanosis or any episode of seizure. When did the cord fall? All these are important events which may be seen during the postnatal period. Information about all this has to be collected. Developmental history. Ask for the developmental milestones that the child should have achieved according to his chronological age. Developmental milestones should be assessed in all four fields like gross motor, fine motor, language and personal and social fields. Gross motor development includes information about head control, information about when the baby started turning side, when the baby started rolling over, when did the baby start sitting, when was the baby standing, when did the baby started walking and running. Similarly, fine motor movements include use of hands and finger. When was the baby able to hold the pencil or pen, the type of grasp, whether it was palmar grasp, pincer grasp, at what age did it come? All this information has to be taken from the parents. Language and language development includes the baby's language, how much the baby can understand, how much the baby can speak, the number of words, the use of sentences, whether it is consistent or not, comprehensible or not, whether it is legible or not, all this has to be assessed. The personal and social field information includes whether the baby is able to establish relationship, whether the child is able to recognize mother, have a consistent relationship with the caregiver, is able to have relationship with outsiders, with other children. So all this information has to be sought. If developmental delay is identified in this screening, detailed history and assessment should be advised. Coming to the immunization history, the objective of taking immunization history is to ascertain whether the child is fully immunized, is immunized appropriately for age or not. Immunization history should be obtained under the following headings: the name of vaccine administered, any vaccine missed, any adverse event following vaccination. Coming to the nutrition and dietary history, collect information appropriate for age. For newborns and infant below 6 months, ask about time of initiation of breastfeed, whether it was started within an hour of birth or delayed, the frequency of feeding, like how many times the baby is being fed during the day as well as during the night, duration of each feeding and exclusivity of breastfeeding. If the baby is being fed only on breast milk or is given additional foods along with breast milk, like the baby may be given milk other than breast milk, may be given water other than breast milk. So all this information has to be recorded. For children between 6 months to 2 years, ask about the time of initiation of weaning foods, quality of foods, thickness of food, frequency and quantity of complementary foods, fat or oil being added to the food or not, any source of animal protein in diet, who feeds the child, and whether breastfeeding is being given along with weaning diet or not. For children above 2 years of age, obtain history of dietary intake by making the child recall last 24 hours intake. Not only the child, but help can be taken from the parents as well. We can ask the mother what was fed to the child in last 24 hours. Calculate the caloric and protein intake and compare with the recommended intake. Assess whether diet is balanced or not. Intake of fast food and the frequency of intake of fast food needs to be ascertained. Food beliefs, fads and allergies may be asked. Family is vegetarian or non-vegetarian. This also needs to be assessed and recorded. Personal and family history. It includes personal information of the child. Ask about child's habits with regard to eating, sleeping, bowel and micturition, and behavior with the family members and friends. Ask the parents' age, their educational status, occupation, income, number of siblings, their age and gender. Ask about parents' health status and if they are suffering from diabetes, hypertension, asthma, coronary artery disease, tuberculosis or any disease which may be seen to be running in the families. Details of abortions and deaths of children or any close relative and most likely causes of death on the basis of symptoms preceding death. Type of family and illnesses in the family. Also ask about habits of parents regarding smoking, tobacco chewing, alcohol use or any other drug intake. Social history. Assessment of socio-economic status of the family of the child is also very important because this affects the feeding of the child, the food intake of the child, the diseases that the child might be suffering from may be affected by the socio-economic status. Also, the area of residence of the child may be affecting the kind of diseases that he may be suffering from. So, ask about three aspects: parental occupation, education and family income. The Kuppuswamy scale is commonly used to assess the socio-economic status of the child. So, this is the social history. Thank you so much.